Hi, everyone, and welcome to episode 8 of season 5 of the Fat Doctor podcast. I am your host, Dr. Larmie, and with me today is Dr. I'm going to try and say it really well now, Mónica Peralta. Yeah, yeah. Who I am very excited to have on as a guest. We currently work together in a roundabout kind of way, in that we're both board members of an incredible organization called for the Association of Weight and Size Inclusive Medicine, and we will be talking about that a little bit later on. But before we do, I'm going to hand over to Monica, who, by the way, is fluent in not one, but two languages, maybe even more. But I know for a fact is fluent in not one, but two languages. And it never fails to amaze me how people do that. Like, I have my biggest dream is to be able to speak Spanish as well as you speak English. That's my dream. I don't know if it's ever going to happen, but I'm just putting it out there. So without further ado, I would love to get to know you a little bit more and introduce you, or let you introduce yourself, I should say, to my audience.
Hi, hello. It's a pleasure and an honor to be here. My name is Mónica Peralta. I'm a physician. I'm from Nicaragua. I'm currently living here in Nicaragua. Um, I specialize in diabetes, intuitive eating, and body trust. I'm a body trust certified provider. And as Asher said, we work together at AWSIM. I am the communication committee chair. So, I just like to talk and communicate stuff through every channel. It's open to me, and Asher was so kindly to bring me to his podcast. So I'm happy we can do this.
Yeah, so Monica has by the way, just like in her spare time, has an amazing Instagram page. And if you go into her Instagram account, you're like, how are you able to do all of these things and work? And does a lot for the communications, like as communications chair for AWSIM as well. But you're just amazing. You're amazing. And I mean, I'm somewhat jealous of the people who live near you, who have a doctor who specializes in diabetes, who is way inclusive and is a body trust. Imagine a body trust certified professional. That's crazy. I'm jealous of them. But speaking of them, we often center the US, the UK, Canada, places like that when we're talking about weight inclusive care. And most of my guests live in one of those countries. And I would really like to decenter us for a moment and talk about what life is like in the rest of the world. So what does it feel like in Nicaragua for people who are, who are fat, who perhaps are fat and disabled, perhaps are fat and have chronic health conditions, and are experiencing weight stigma with a doctor? What's the vibe in your end of the world, in your part of the world?
Well, there's definitely a vibe because, weight stigma is rooted in so many different things. But when you live in Latin America, besides racism, that we know that that's one of the roots of weight stigma, then you have colonialism. And then you have economic disparities that we live here in Latin America. And sometimes when, you are sick or you get an illness and you go to the public health setting, you're not going to be in a private bed. You're going to be with more than 20, 15 patients. And doctors, we are doing rounds and we are blaming you and your body for your disease in front of all of these people, and all of these people have families with them, so you don't only have the patient. So now you have, because of the cultural surrounding that I was talking about, Latin American people, we don't speak quietly. So we're not only talking to you like, oh, hey, well, because of your body, you have no. It's because you are always eating, and we're loud. We're kind of loud. So imagine just the shame that comes with it. Not only you're getting a diagnosis that it can affect your life, your whole life, forever. Then you have all this shame, not only surrounding that diagnosis, but surrounding the way that that diagnosis is given.
Yeah.
And so that's cultural. And then, well, as I was saying before, we have economic disparities that prevent us to get that information about weight stigma, about weight bias. I didn't know about fat phobia 5 years, 6 years ago, because we have all these barriers. We have language barriers. We have paywalls. I didn't know about so many scientific articles. And, I live in Nicaragua. So then how I have access to them? Am I gonna pay $300, $400 yearly just to get access to one journal? There's not only one, there's like five, six. And I remember that my university used to have like one user, one code, because one of the brothers of the brother of the brother of the dean of medical school lived in the United States. So we had access through that. And after I graduated from medical school, I was like, there's so many things that we don't have access to, and we didn't have this information. And then with the boom of social media, we had access to the rest of the world and to see what the people were doing. And the first time I opened Instagram was for me to share my weight loss journey and to be this example of discipline. And I'm a doctor, and well, I've always lived in a fat body, but I do have other privileges that I live with. And I didn't even know about privileges. I was like, no, that's not a thing. People are just, they take everything too deep. And, because I am Latin America, I was like, people are just weak. There's people dying, Kim. There's people dying. And I was like, oh my God, there's so much that I don't know about. And then I, of course, grew up with moms, aunts making comments about my body, and we are not supposed to talk back to them. We are taught you don't talk back to elders. So whatever they say, you just nod, and that's it. And I'm so glad that the new generation, they are like, I'm not afraid of it. I'm gonna talk back. I'm gonna speak back. Because also, I think that because my generation now is the aunties, the uncles, we know how we grew up and how all of those comments affected our body image and our relationship with food, that we are not willing to risk it with this new generation. So they don't live within that environment. I think I just went everywhere right
You
now.
did, no, but that was so amazing. And first of all, Snap, I also joined Instagram to share my weight loss journey, to be that doctor who was like, look at me, I lost weight.
Of
Aren't I
course.
amazing? We both know how that turned out. But I
Uh,
love you speak to so many important things, right? You speak to the kind of the culture of weight loss, weight shaming, weight stigma, like within our families, and also how that has kind of also impacted how doctors treat their patients, because at the end of the day, we're humans, right? We grew up in our neighborhoods with the same uncles and aunts and parents and schools and everything, so we do what we're used to doing. And living in a country where we have free healthcare, and so private rooms are only for people who need to be separated for medical reasons. I'm used to the wards and the ward rounds and being in a big busy ward, and it's so true. All you have maybe is a curtain for privacy, and doctors do not care. They say whatever they want to say in front of everybody, and that's not okay, because confidentiality is an important part of medicine. But you're right, it brings all the shame and the stigma. What is it? So kind of like culturally, what is food and body image and food? What is it like? So I have a Brazilian mother, so I grew up with some Latin American culture in my life, and I think perhaps it's very different to the culture in the UK. Certainly, how do people feel about food and body weight, and how much access do people have to food, and what's kind of going on in that kind of area?
Actually, I think 2 days ago I read Latin America was one of the most expensive places for a healthy diet. But again, what do we mean with a healthy diet? Because of globalization, we don't want people to be eating carbs because carbs are the enemy. And Latin America has so many cases of diabetes and people are still eating carbs. So rice and beans are out of the question. And that's, one of the main dishes for Latin American culture. And you're telling people, oh my God, no, rice and beans are so bad. They are so high in carbs. So what is a healthy diet for us? Mediterranean diet. You have to have olive oil and olives and Roman lettuce. And I'm like, what the fuck did no,
What
like
the
that's
fuck? That's
expensive.
yeah.
Like, what? And that's a repercussion of lazy medicine because why we as doctors are not saying, you know what? We have this food, this is our local foods,
Mm,
and they are high in nutrients. And there's so many combinations we can do. And you know what's gonna affect more the patient than rice and beans? I mean, they do not, but you know what's gonna affect more? The burden, the mental,
yeah.
all the mental space that patients spend in saying, "Oh my God, I didn't buy the quinoa. I'm not having salmon." And
Yeah.
oh, really?
Yeah,
Really?
exactly. And the thing that makes me really mad is rice and beans is like one of the most nutritious. Like if I personally live on rice and beans, for a good portion of my week because I know it's cheap, it's easy, it's tasty, and it provides all the nutrition that I need, really. Add a few vegetables and I'm done.
And that's a perfect sample when you can see, the whitewashing on
Yes,
nutrition.
yes,
Because when vegans have rice and beans, oh my God,
yeah,
they're vegan. So,
yes.
they're doing the Lord's work, eating rice and beans. Oh, but when we do it, that's not good.
That right, right.
And
So
then you have body image aspect of Latin America, where you have to have curves, but in the right places. You have
yes.
to have a meaty body, but in the right shape. So
Mm,
you don't get to be too thin because that's sign of, oh my God, she's not eating and she doesn't have the curves of a Latina because Latina have to be curvy but not fat.
yeah,
So that's a whole nother topic,
right.
because you get to have this voluptuous body, but just like there's a centimeter, like 1 centimeter more,
Yeah,
and you're like, out.
right. Yeah, it's a very
You're not
narrow.
fitting.
Yeah,
Oh yeah, like you're not fitting that beauty standard anymore.
right. I saw a post on this actually on your Instagram account about how you're allowed to have curves but not be fats. Two very different things, right? Mm,
And there's a right type of fat.
right.
We can talk about the good fatty. Oh, she's always trying to be this thin person. She's just a thin person in progress, I think we call it.
Mm,
And that's like, no, dude, I'm just fat. Diversity is a thing. We're not supposed to all look like the same
yeah,
yet, because the world is going places.
that is true. Um, so you are a diabetologist, you're a diabetes expert. I am diabetic. I feel like this is a perfect moment for me to come to you and say, hey, by the way, diabetic patients get treated like garbage. I'm not saying that we have it worse than other people. However, if you had to pick one illness that is associated with being a bad fatty, I think diabetes at least will be in the top five, I reckon. I still think it'll be top, but top five at least. And so I have, at the moment, my A1C is quite high. It's not well managed. I'm one of these people that got diabetes after COVID. And they blame, oh, it was because in the COVID pandemic you were being lazy and you were eating and you weren't exercise. I'm like, in the COVID pandemic, I was busier than I've ever been in my life. Because we were sorting out COVID, right? Like I didn't rest. I was constantly on the go, which may well explain. I was also on a diet during COVID, because of course I was. But anyway, so I'm that diabetic. And I go and see my doctor. I don't get to see a doctor. I see a nurse, and the nurse does three things. First of all, ask me a whole bunch of questions about my diet. Am I adding sugar to my coffee? Am I using low-fat spread or butter? Am I using the right oils? Do I cut the fat off my? I'm just trying to tell you what I was asked yesterday. Do I cut the fat off my meat? I mean, off my steak, actually, I was asked. I was like, wow, you think I eat steak? Amazing. And what else was I asked? I was asked all sorts of questions. Do I get enough exercise? And then there is the whole like we need to weigh you and you need to consider weight loss. And then the third thing is, oh, and now we have to treat you and we have to give you treatments that are going to reduce your weight. Like we can't just treat you like a diabetic. We have to treat you like a fat diabetic. Like there's a different route of treatment for diabetics versus fat diabetics. Um, and it really pisses me off. And I think I'm experiencing a lot of weight stigma. And as somebody who is an expert in both weight stigma and diabetes, I wonder, do you think that diabetics experience weight stigma?
125%. That's why I went into diabetes because I thought I'm gonna say there's no other diagnosis that experience the amount of shame that comes with diabetes, because I think if we take out for a second the weight stigma, just the shame surrounding diabetes,
Mm.
because it's self-induced. You
Mhm.
did this to yourself because you ate too much carbs, too much sugar. And then if you live in a fat body, of course, I mean, look at you.
Mhm.
Because I had a life experience that I'm always telling people about this. I went with a friend to I accompanied her to a doctor, and the doctor saw some labs, and he just started talking like, oh, hey, he was talking to me straight, and he was, oh, see, you have diabetes, high cholesterol. Well, this is no surprise, Monica. And I was, because I introduced myself first, but he didn't see the name on the labs, I guess. And I mean, look how you obviously had yourself let go, and you know why you're not taking care of yourself. And if you're not taking care of yourself, you're not taking care of your family, your kids, because again, the context, Latin America, I'm a woman, I'm supposed to be a mother, I'm of a certain age. I'm married, I have a family. I don't have any of that. I don't even have a live plant, like a plastic plant. I don't even have that. And all of all of that time, I was like, what's going on? This is worth $60. Like, am I not charging enough? All of these things went through my head. And then when he was finished, of course, um he opened a folder, he gave me a diet, a lifestyle changes, and an exercise regimen. And I was like, you know what? I'm not the patient. This is the patient. My thin, white, cisgender friend with the straight hair. Beautiful. She's the patient. That man went through so many rainbow colors in his face. I mean, I think he almost got his blood sugar higher than my friend. He was, and he was not ashamed. You know what he told me? Well, I just gave you a free consultation because eventually you will be where she is. And you know what? I'm not one to shy from a fight, because when you live in advocacy world, in weight stigma awareness, I think we're always like ready,
Yeah.
like ready, set, go. Like
Yeah.
you're just like 1 minute away. And I was like, oh no, you're gonna get school.
Yeah.
You are gonna get a free webinar about what you're doing wrong in your consultation. And that's just an example, every doctor, we all have weight stigma, we all have weight bias. But the difference is that we treat human beings as doctors. And you took an oath and said that you will do no harm to people. And then, ironically, when people get ill and go to you because you willingly I know some people don't, but willingly went to medical school and said, oh, I want to treat people. And they willingly go to you and you treat them like trash and you blame everything on them. And diabetes, I mean, the discourse surrounding the disease and the pre-diabetes, that bullshit that can I say bad words here? Like my
Of
brain
course you
just
can,
okay, yeah,
please.
I'm sorry.
Yeah. In fact, you should try and say as many as you can.
I'm sorry. And then, we have all this fear mongering and giving people, instead of hope, instead of doing things to do, we're just giving them fear and shame.
Mm.
And we think people are gonna make lifestyle changes because of the fear. And maybe that's a good month. Good 1, 2 month. People are gonna be, oh my God, I have to go to the doctor, so I'm gonna do this. And they are gonna spend their whole salary on these lifestyle change behaviors. But diabetes is for life. It's not a short race. You're here for the long race. You're not here for the 10 to 15 pounds that people lose on the 3 months that you gave them a diet. What about the regaining weight? Do these doctors know about weight cycling and the impact on diabetes?
I've had these conversations, like, tried to have these conversations where I've said, you're telling me that if I lose a lot of weight, I'm going to put my diabetes into remission. And I'm like, I get it. You're basing that on a trial that I have studied in great detail. And I've looked at the evidence, and I'm telling you that that was wishful thinking in the first year and a bit of a reality check in the second year. And by the fifth year of the diet trial, it was like, oh yeah, probably only temporarily, right? And I don't want to put my diabetes in remission temporarily because the weight cycling is going to make that worse. I truly believe that, I lost the most amount of weight and just prior to my diabetes diagnosis, maybe a few months, maybe 6 months. And I genuinely believe that in combination with COVID, and I was genetically predisposed because family history, and I had a history of gestational diabetes. So I knew I was insulin resistant. It had been almost 10 years. It was kind of my time, right? I was expecting it. I knew it was coming. But in spite of that knowledge and understanding, I struggle so hard to get my doctors to understand the most basic science, like the weight cycle. I say to them, every person that goes on a diet, they regain the weight, right? And they're like, yes. And I'm like, so why are you telling that? They don't have an answer, but they just revert back. But that's what the evidence says. And it's like you can't have these conversations because they're not logical. They're illogical based on weight stigma and disbelief. But one of the things that I feel like, it's a hard fight. Like, what would you say to somebody who's saying to you, I'm not lucky enough to have you as my doctor, and I'm just struggling, and it's a fight, and I just don't want to go. I'd rather not go. So I keep putting off my appointments. What do you say to people in that situation?
One of the most common advices that I hear is that you ask your doctor, if I were a thin person, what will you say? I just hate that because I don't want to be treated as a thin person. I want to be treated as a human being that is in front of you, asking, know your basic science. So when you are facing a diabetes diagnosis, and as you said, I'm here for the long run. I'm not the one to say, like to your doctor, do not. Please, we need all the information. But sometimes you can modify a little bit how you ask the questions. And you can say, you know what, I'm doing everything you are telling me. Of course, I'm in my weight loss journey, but as you can see, my numbers are not changing. Is there something more? Is there anything else that we can focus? I am 100% focusing on weight loss and doing everything that I can. But in the meantime, I shed off those pounds. Can we do something else? Do you know about any combinations of food that would help me to have a more stable blood sugar? Why are you recommending fasting when you know basic science that's gonna mess with my blood sugar?
Mm.
So just these little questions like of if you go to a doctor and you know that he's a weight-centric professional, and of course it's a privilege to go to someone who is a weight inclusive. So if you know that he is weight-centric and he or she, them had a weight-centric approach, sadly, you have to go with that.
Mhm.
I mean, you don't have to, but
Mm.
sadly, you have to go in that route and just try to navigate that without telling them, like, I don't believe in weight loss. I mean, you certainly can do that, but the doctor is gonna be apprehensive. Like, he's gonna be like, oh, I'm telling you that you're not getting better because you are not working on the weight loss. So if you
Mm.
ask the right question, is there something else that I could be doing?
Mhm.
I'm focusing on weight loss, but is there something else? Maybe having more structure is gonna help me. Do you know something about that?
Mhm.
And truly asking the doctor, do you know about this?
Right.
Because then doctors are like, I know everything.
Mm.
Of course, I know everything. And they
Mhm.
have all these just, sheets that they give you, like
Mhm.
the same for everyone.
Mhm.
If you don't know anymore, if you don't have any more tools, if you don't have any more resources, can you refer me to someone? Should I be having a more integral management of this diabetes? Should I be going to a nutritionist? Because,
Mm.
doctors are always talking about nutrition and
Mhm.
diets and weight loss, and we don't have the academic built for that.
Yes.
We don't see nutrition. I mean, maybe 20 hours, 25.
That's
That's
amazing.
not
I did not have
enough.
that. Yeah, I didn't have 20. That's way too much. I did not even have that. And I agree with you. And one of the things I do say is, oh, I'm working with a nutritionist. Um, because I have worked with a nutritionist in the past. Again, that's a privilege, but also my working with a nutritionist is following a couple of diabetic nutritionists, weight inclusive diabetic nutritionists on Instagram. As far as I'm concerned, that's good enough. I also lie, and I don't lie about the things I know I shouldn't lie about. Like, I'm not going to try and deceive my doctors because that only harms me. But when they ask me about how much sugar I put in my coffee, I'm not answering that. I mean, I don't drink coffee, which is really easy. I'm like, oh, I don't drink coffee. But if they ask me about, like, do you use low fat spread? I don't have any problem lying about that. Sure, sure, yeah. Healthy or Mediterranean diet, of course I do in Mediterranean because I know that that is completely irrelevant to my life. And also, it's really bullshit medical advice because I don't think the Mediterranean diet is the best diet for diabetics. In fact, I think that there are much better things. In fact, I'm sure we can talk about it, but we don't need to talk about it. There are other people who are talking about it. I would be very curious. I want to ask you about GLP-1s, but in the context of diabetes, because I know a lot of people know that Ozempic and all the other ones. There are other ones, by the way, for those who are listening. It's not just Ozempic. There are other ones too. Um,
And there are more coming.
they're more right. So these drugs were originally designed for diabetes and used to treat diabetes. And I have seen them in my practice, and you probably see more diabetics than me, but I have seen them produce incredible results in terms of reducing blood sugars. And I've also had patients that are like, meh, not really. It depends. I mean, they're not perfect for every patient, but I have seen that they are effective in many patients. But they are very difficult to tolerate. There are very few patients that come back that say, yeah, no symptoms or side effects whatsoever. So a lot of my patients will have been started on medications like Ozempic. They'll be on them for years. They bring the blood, I mean, their blood sugars are either reasonable or sometimes still out of control, but they're on this drug that is making them miserable because it is a weight loss drug and it's the weight loss and it's the curbing of the appetite. Because I was just prescribed it yesterday. But this is really good for you because it curbs your appetite. And I was like, how is that good for me? Can you explain to me why that's good for me? Because you won't eat as much and you won't be as fat. And I was like, but in terms of my diabetes, How is that good for me? Oh, because it's a treatment for diabetes. And so then you're like, okay, I'm stuck now between a rock and a hard place. And I made the choice to just say, sure, I'll take it, and then turn around after a couple of weeks and say, I can't tolerate it because it makes me feel sick. But I'm curious what you think about GLP-1s or just in medications to treat diabetes, and how we as doctors now will have preferences based on our patient's weight, if that makes sense.
Yes. So GLP-1s are not new.
Hmm?
They have been with us for so many years. But of course, the weight loss industry found a way to have them work for them. I'm always saying the GLP-1s now switch and they are working with the weight loss industry. They're no longer working with the diabetes industry.
Mm-hmm.
So the main function of the GLP-1s for the weight loss industry is, as you said, they curb your appetite and you basically stop eating. Your hunger cues are gone.
Mm-hmm.
Something important for me to mention is that medication within the diabetes treatment world really sucks. The side effects really sucks. And we have this lifelong condition and we have shitty treatment, shitty pills, shitty injections.
Mm-hmm.
But then we are willing to put healthy patients,
Mm-hmm.
because being fat is not a disease,
Mm-hmm.
we're willing to put healthy patients with healthy pancreas through these side effects. And when a person is diabetic and the GLP-1s are working, the patient will say like, okay, this is working, this is lowering or making my blood sugar more stable, but I have all these side effects. But I'm gonna live through it. I'm gonna live with it because it's literally saving my life.
Mm-hmm.
It's working great with my glucose. And we actually have to inform the patient about all these side effects. You don't give a patient a pill or an injection and you know what, just have it. No, you have to inform consent, people. Inform consent. Are they willing to live with these side effects?
Yeah.
But then, as I said at the beginning, weight loss saw these weight loss injections and said, oh, if we up the dose or if we do this and that, we can make people stop eating, making them feel fuller for a longer time. So of course they will lose weight. And of
Mm-hmm.
course we can profit off it. And these big pharma, when they see opportunity, they are not letting that opportunity go anywhere.
Mm-hmm.
And now GLP-1s have all this research because I think the longer a step is 5 years as of now. So we have all this research for weight loss. And we have people that are healthy on these GLP-1 injections for weight loss. And they are experiencing all these benefits. That is, they're not hungry. And then, but also they have all these gastric side effects, but it's
Mm-hmm.
worth it because they're losing weight. But what people are not getting or doctors are not telling their patients and is that you're not going to be able to get off the GLP-1 if you want to maintain that success.
Yeah.
And I read an article, I think a few days ago, that people that are going into GLP-1s are having a better mental health and they are getting off depression, blah, blah, blah. And I was like, they are treating better because they are losing weight.
Sure.
Their surroundings, their families, their friends are treating them better. And
Mm-hmm.
maybe they're getting opportunities that when they were fat, they were not getting.
Mm-hmm.
So are we really doing the right research
Mm-hmm.
about linking less alcohol consumption, better mental health, GLP-1s, because of the GLP-1s, because of the substance of the GLP-1s, or because of the surrounding of that patient.
Yeah.
So all this research and all this money that went into making GLP-1s for weight loss, I just imagine what all that money could have done making those GLP-1s better for diabetic people.
Right. Because here's the thing, if there's a drug that's going to bring my blood glucose down, I'm going to take it. I'm going to try it. When they said take metformin, I took it. Did it make me go to the toilet a million times? Yes. I learned to deal with it. I found a way through it. And then they said, here's an SGLT2, here's dapagliflozin. That's the one that's used in my neck of the woods at the moment. It's the best one, apparently. Here's a medication. It's going to make you pee all the time. You're going to get up in the night, or you're going to have thrush. It's going to be never ending. It's very unpleasant, but it will help your blood sugar. I said, give it to me. I'll take it. It's not a problem. I'll have it. Then I was given a medication, sitagliptin, Januvia. I was given that. I was given 3 months. It didn't work. Stop it immediately. It's not working. I was like, dude, it's going to take a bit more time, but they didn't care. And then they said, go on a GLP-1. And what's interesting, we can't get the injectable forms in where I live because of we still can't access it because there's not enough to go around. So we have to use the oral tablets as opposed to the injectable. And again, we have to use semaglutide, not any of the other ones, semaglutide. And it's being pushed as, oh, the benefit is you won't be hungry, you will lose your appetite. And as someone who believes very much in body trust and has been practicing intuitive eating, and it's not just intuitive eating, intuitive living, where I have spent the last few years learning to tune back into my body, to listen to what it's telling me, to be kind to my body, to give my body a chance to trust me again. Because for the longest time, my body would tell me stuff, I would ignore it, and my body lost trust in me, let alone me being able to trust my body, right? So I don't want to lose my hunger cues. You're messing with something that is integral to my well-being. Hunger, for me, is really important. It's part of my life, and I don't want you to take that away from me. But I sound like, for all intents and purposes, I sound like a crazy person when I say that. What do you mean you don't want to get rid of hunger? But then you'll lose weight. I'm like, but I don't want to, and that isn't seen as good enough. And of course, the moment you say no, you become the non-compliant patient. I hate that word, non-compliant. That's it. Now you're a pain, touchy about your weight, has an issue, is difficult to manage, needs to, oh, what do you need to see as somebody else? And people just get really horrible about it. And so I'm really glad that you said, by the way, medications for diabetics suck, because they do. None of them are well tolerated. And if you told me there was a GLP-1 out there that wouldn't cause so many side effects, I would take it. I would be like, yes, give me that. I want that one. I don't care about weight loss. Give me the one that I could tolerate so that my blood sugar is better, But thank you for saying that. I don't want to focus too much on GLP-1 because I feel like that's all we talk about nowadays. I'm sick.
But it's amazed me because also people are not doing the right research, or we're not talking enough about eating disorders and GLP-1s.
Right.
And diabetes and eating disorders go hand in hand. There is so much correlation between eating disorders and diabetes.
Yes. Thank you for saying that, for naming that out loud. It's so true. And we are prescribing eating disorders to diabetics. We're like,
we would not prescribe those disorder behaviors to thin people. So what we diagnose as eating disorder or as disorder eating on thin people, we are prescribing as treatment for fat people.
Yes. Yeah. Speaking of Novo Nordisk, I don't want to give them too much airtime because I'm sick and tired of talking about them. However, March the 4th is World Obesity, pardon the language, but Obesity Day. We're allowed to swear on this podcast, but we try not to use that word. But it is the name of the day. It's the 4th of March this year. Tell me your thoughts. What do you think about this wonderful day that is coming? Should we celebrate?
Oh my God. It really surprised me that as human beings, we are okay with having a day to eradicate a type of human being, a type of person, a body type. We are okay with telling people, hey, March 4, we wanna eradicate you. We don't want you to exist. Welcome to World Obesity Day.
Yeah.
What the fuck?
Yes.
Are we okay as human beings to tell people we have a special day when we don't want you to exist anymore? And we have all these recommendations for you to stop existing.
Mhm.
The fuck? I mean, and then the audacity. The
Yeah.
audacity of a white man, because there's a white man behind that. To if you go into their website, they talk about weight stigma on the
Mhm.
landing page. We have to stop weight stigma. And they have this beautiful chart of how weight stigma impacts obesity and how if we they say like if we treat yeah, how they say? Yeah, if we keep treating people that lives with obesity bad, they're gonna keep being fat. And we don't want that. And that's why we have this day, because we don't want you to exist.
Mhm.
But also, weight stigma is bad and it's gonna impact your health. The weight stigma that doctors have and I mean your whole surrounds. So weight stigma bad. But we have all of this day to tell you why you shouldn't be fat. And that's not fitting the weight stigma of the people. Having a whole day to tell people to not exist. I mean, you are giving them permission to perpetuate that weight stigma. You have a whole day to give people permission to go on social media and every channel. Hey, happy World Obesity Day. Here are all these recommendations for you to not exist anymore because you're not allowed. Diversity, that's not a thing. Stop. Ugh. I
This
mean,
was this was a mic drop moment if ever I've heard it. I just wrote on a piece of paper this clip. You need to immortalize this clip right now. Of Monica basically saying about to cease to exist. It is exactly right. No one has ever put it like that before, and I love you for it. I have nothing to say, just this. And I'm really annoyed because my phone, I hadn't turned my phone on silent and it went off, and I'm worried that it's ruined the recording now because that needs to be memorialized for
I
life.
mean, are we okay with having a day to eradicate another diversity on the human beings? No, we're not.
No,
But
no,
we're okay with telling fat people stop existing.
yeah, yeah, because we can control it. I don't know if you know that. Like it's absolutely
Oh,
under control. Yeah.
yeah, I just forgot about
Did you
that.
forget that?
Oh my God, yeah. You know what? When today,
Yeah.
I'm gonna stop being fat.
Oh, me
Yeah,
too. Let's make a decision together. Let's shake on it. Virtually shake. That's it. We are tomorrow, as of
because
tomorrow.
this is gonna be the time that everything works.
Yes.
This is the last diet,
Hmm.
and everything is gonna work out.
Absolutely. That's 100% going to happen. I'm sure
And
of it.
we are gonna, on World Obesity Day,
Yeah.
we're gonna be the champions
They can
because we're
feature
gonna
us.
stop existing.
Yes. We can be a before and after picture, before and then like no longer here after. Done. Gone.
And then they have ended with a stigma with
Yeah.
us stop being existent.
Yeah, it's interesting. I always find this really interesting. You read a study that says, like you said, depression. You're more likely to be fat and depressed. And of course you are, because if you're fat, you get treated like garbage by your family. You know that you're different. You don't get to, you have fewer social interactions because it's harder to live outside of your home. You can't get the clothes and you can't travel and people stigmatize you all the time. And chances are you have a lower income and all of that stuff, all the stuff we know. So yeah, of course that's going to make me depressed. I mean, like, why?
And then your weight is keeping you away to get that mental health treatment. So
Exactly. That's
it's a cycle.
right.
I'm depressed because of the weight stigma that's around me and because of how people treat fat people. And then I have, of course, someone saying that I'm playing the victim
Yeah.
and that I just should shake it off.
Yeah.
And then I don't have access to mental health because of my BMI.
Yes.
And then, I mean, and then, of course, if we go a little bit back to World Obesity Day, obesity is only, I mean, the origin of the word, horrible.
Mhm.
But then it's a diagnosis based on BMI that doesn't work for shit.
Yeah.
And of course, they have a day based on a misdiagnosis. Because when you don't have, if you don't have another tool to confirm an obesity diagnosis, that's not a good diagnosis.
Yeah.
You
Right.
have a whole day
Yeah.
celebrating
Mm.
uh, a, a, a shitty diagnosis.
Well,
Laziness
a medical condition, not just a diagnosis, a medical
and medical.
condition in which the only diagnostic tool that we have to confirm this diagnosis, this condition is, as you say, the BMI, which we have all universally agreed is not fit for purpose. Isn't it? Doesn't work. It's not effective.
And that maybe if these scientist people wake up tomorrow angry, they just can change the table and the markers. And maybe you and me just go higher and higher. And because they had a really shitty dinner
Mm.
and they woke up angry and they decide to change.
And what can we do to stop it? But what fascinates me is then we say, okay, so we know that weight stigma is a problem, and we know that is actually impacting healthcare, and we know that that's making people depressed. And so the treatment is to make them thinner. Because
Yes.
why is it not obvious that we could just work on the weight stigma instead? Like that would just be as effective. In fact, it would be more effective because at least weight loss is only temporary. So this is going to be like the fix the underlying condition. Isn't that what we're told to do as doctors? Treat the underlying condition. If the underlying condition is weight stigma, if that's what's driving the depression, then the solution is not to make them thinner. The solution is to treat the weight stigma. Oh, but that would involve us.
That's too much work, Asher.
Right. It's too much work, and it would mean that we were in the wrong. And
Yes. And if you see that with a cultural lens, with a Latin American lens, in Latin American, doctors are God.
Yeah.
Whatever the white code says goes.
Yes.
And so that's even bigger here. Because if the doctors are never wrong, never, never, never. So when you say, oh, they have to work on their weight stigma, or, there's some inner work that you have to do. What? I'm a doctor. What do you mean? What do you mean I have to do the work? You are the patient, little girl.
Yes.
You have to do the work
Right.
because I am the doctor. I know everything. I have the white coat.
Yes. That makes me
So
go.
I think getting health professionals to admit, because I mean, if I talk from my transition from being weight centric to weight inclusive, it was really hard for me to admit that I've been doing harm. And for me to say, what a shitty person. What was I doing? Did I went to all this medical training for this? And I had to admit so many things, not only about weight loss, but my privileges and my racism and my everything. And it's also a privilege to take that time to say, okay, I have to work on this to be able to help in the best way I can. But that, that, how do you say, like, that inner look that you have to take, it's better just to yell to a patient and say, hey, you're not doing what you're supposed to do.
Right. takes all of a few seconds to do that. Whereas inner like unlearning and all of that stuff, deconstructing, and oh, that's hard work. Yeah.
And with a patient, you have 15 minutes.
Yeah,
And I mean, it's easier.
it is. I think we should end this podcast with a bit of hope. We talked in the beginning about the Association for Weight and Size Inclusive Medicine. I have recently joined the board, but obviously you've been there longer. So tell me about your kind of like journey to this organization.
So Lisa is the president and founder of AWSIM, the Association for Weight and Size Inclusive Medicine. Lisa and I connected through ASDA, which they are the Association for Size, Diversity, and Health, who they own the trademark for HAZE. And Lisa and I, at that moment, we were the only physicians on their list. So she contacted me and I said, an association where we are all weight inclusive, clinical physicians. I said, count me in. And we had a Zoom and she told us, a little group, the idea. And it was perfect for me. I mean, it's something that I long hoped for.
Yeah.
Because I live in Latin America, here things are in diapers. You know, weight stigma, fat phobia talk. We have a long road ahead. And then, well, AWSIM was created. We are all a volunteer board, as you know. All our work is volunteer. And what we are effectively doing is to be this space to have networking opportunities, to have community, to be as safe as we can a space for healthcare professionals, not only physicians, to share their doubts. You know, the transition between a weight-centric and a weight-inclusive approach can get really lonely, can get really confusing because we are used to, weight loss, to weight loss partying. And when you're doing that shifting, and then what am I supposed to do? All my career, I've been prescribing weight loss and saying fat is a disease, blah, blah, blah. And now that we can center all of these healthcare professionals and have this community, it's easier. And there's so many, I mean, this association opens your world to different perspectives because we are not all gonna be agreeing in everything.
Yeah.
Maybe some people think, oh, that idea is too radical. But you know what? Okay, I'm gonna read it and that's it. And then you're gonna think that's not radical enough. So AWSIM is that, and also it's a place where we are creating opportunities for healthcare professionals to grow within the weight inclusive world, and also that we can have this safe space for patients and a better attention to patients. And we are trying to have all these resources uploaded every day. We are updating those resources and we are trying to go through every channel with this message of weight inclusive medicine.
And you're doing a very hard job, I have to say. I was so delighted when I heard about the organization. It was actually at the time of launch. So I think I found the Instagram page that you run, and I saw something about, like, I can't remember what it was, but it was like there was doctors talking about weight inclusivity, and I was like, it's not that I thought I was the only one. It's just I didn't know any other doctors. I had many dietitians and nutritionists and fitness professionals, and I knew lots of psychologists, but doctors, I didn't know. Nurses, I'd met a few along the way who'd come and, whispered in my ear, I'm like you, But, it's really difficult for me to be like this in real, in at work, which is, of course, brings its own challenges. But it's just so wonderful to know that this organization exists. And I really believe that one day soon we will have a seat at the table, that when it comes to policy, when it comes to, what is happening in the world, that we will have a louder voice. Because a lot of people, when you say to them, hey, how can I help you? What can I do for you? A lot of people I've asked that, they've just gone, go and tell your colleagues. Please go educate your colleagues. And I think that is definitely something that we and everyone at AWSIM is passionate about. So there is hope. There are doctors out there. We're few in number for now, but
And you are the advocacy chair. So
I
we are
am.
truly gonna make some changes. Changes are
Yeah.
coming.
Yes, changes are coming. I believe it. Like, we're gonna try and make it as quick as possible, but also it has to be right. We have to get it right. But I just want people to know there are doctors out there that care. And there are more and more coming out. I think like it's almost people, like I said, they're whispering in our ear. They're coming out of the weight inclusive closet and kind of going, yeah, actually, I think you might be right. And it will snowball. I
Yes.
believe.
And also we are, I think as AWSIM, what it's doing is planting that seed of doubt
Mm.
and oh, what's this? That this makes sense. I don't want to treat people badly. I'm
Mhm.
gonna look and that's if AWSIM is doing that, just planting the seed of the doubt, we are doing a lot.
Yes. Amazing. This has been really one of the best talks I've ever had. I love it. Don't tell me, tell everybody where they can connect with you, work with you, things like that.
Well, I think the easiest way is through my Instagram page that has my web page. So my handle is doctora, well, no, DRA dot Mónica Peralta. And my web page is www.monicaperalta.org. And I work mainly online and I do work in Spanish and English. So yes, through Instagram is I think the easiest way because you have all the links.
That's amazing. Do you hear that, people? Are you listening? Both in Spanish and English and online. I'm going online shortly to see what I can grab, because that is just like, it's how amazing. I'm going to put your links in the show notes, obviously. Also, if people don't know that in Latin America it's DRA, then you've learned something new today. You should know, but if you don't know, you're forgiven. But now you know. Don't ever forget it. We have to stop centering. I always feel really
And I
bad when we
always try to put subtitles in English, my captions in Spanish and subtitles in English. Sometimes the translation that Capcom gave me is not that good, but I try.
You do, and I just think it must be it's so much extra labor, and it puts you at such a disadvantage. It really does, and I really applaud, and I'm so grateful for you, and also really glad that there is somebody out there whose primary language is Spanish and is doing this work in Spanish. Because why should everybody have to do it in English? I'm just really happy that you're doing the work, but also truly, honestly appreciate the fact that you take the time to include English speaking people, which is, not necessary, but certainly is. I am grateful for it as a non-Spanish speaking person yet, although I'm determined. Didn't go so well with Duolingo. I need to find another way. Honestly,
You'll have to come to Nicaragua
I
and
think I
we'll
think
give
that's the
you an
solution.
intensive course.
That's the solution. Just spend a couple of months there. I'll be fluent in no time. And 2 months, I mean, sounds like a party to me. So anyway, thank you so much for joining us. I hope to have you back soon. But everyone, I'm sure will agree that this was a really fantastic conversation and very, very helpful.